Welcome to the Savvy Dentist podcast with Dr. Jesse Green, the show where great dentistry meets great business. Listen in each week as we bring you an inspiring person who will share their story, ideas and business techniques to help you create a practice and a life you love. And now introducing your host, Dr. Jesse Green.
Hello everyone, it's Jesse Green here. Welcome back to SavvyDentist.com and to the Savvy Dentist podcast. It is tremendous to have you here for another episode of the show. Now today we're taking a slightly different approach with our podcast because today we're talking about CBCT and how to integrate it into your dental practice, into your general dental practice particularly. Now, the thing with CBCT, we all understand that 3D imaging brings with it some tremendous benefits from, better ability to diagnose pathology, better treatment planning, better patient outcomes. But there are a few hints and tips to make that journey easier. There's a couple of pitfalls we need to be mindful of. And my guest today is Dr. Acrane Li. And Acrane is a trained radiology and nuclear medicine imaging specialist. He's got an incredible pedigree around this. He works with oncology. He's been involved in molecular imaging. But more recently, he's had extensive experience working with dentists and really getting involved in head and neck anatomy, understanding the dental pathology, the dental imaging space better than anyone I've ever come across. Now, what we're going to be talking about is a couple of things that we all need to be aware of as we adopt CBCT. I really believe that CBCT is going to be, it's already got a huge part in general practice, but I think it's going to become integral to general dental practice. And part of that is going to be about how well we report our imaging. And so Acrane has got an imaging reporting service, which if you're interested in finding out more about, head across to actdentalimaging.com. So actdentalimaging.com, Act Dental Imaging, and you can get more information about that. But in this conversation, we cover a wide variety of topics. In actual fact, we talk about what CBCT is and what it's not. We talk about its usage and adoption. We talk about some of the benefits of CBCT. We talk about the radiation, I should say, and the dosage required around that, and a whole bunch of other things. We talk about the clinical case. We talk about the commercial case and how it fits into a general practice. And what I really appreciate about this conversation with Acrane is he's able to take a complex subject and make it accessible for everyone. So in this conversation, there's going to be a lot of insight, a lot of practical tips, and I hope you enjoy this podcast as much as I enjoyed recording it for you. So here's Dr. Acrane Li. Acrane, welcome to the Savvy Dentist podcast. It is fantastic to have you here. So thank you so much for taking the time. It's good to have you. How are you?
Yeah, I'm good. Thank you for having me here today.
It's a pleasure. Now, mate, we are going to be talking about CBCT and its application in dentistry, and we're going to get into the nuts and bolts of that, but particularly around the reporting requirements and how to do that really well. But before we do get to that, I'm curious to ask you about your background. You've got quite a long CV. How did you find your way into this field? Was it something you always wanted to do? Was it accidental? Was it something, a gradual awakening for you? How did you find your way into this field?
I've always been interested in sort of the academic side of medicine, and I think imaging is a very good field to encompass all of that. It requires you to be sort of quite methodical, quite a lot of knowledge. It's a knowledge-focused specialty as well. So I started off my radiology training in New Zealand, actually. So I'm a Kiwi by birth, and I did my radiology training there, and I came across to Aussie here in Melbourne, and I did my nuclear medicine training. So it's more imaging, more subspecialization in radiation-related field. When I trained at Monash, I led a lot of MDMs, especially in the oncology subspecialties. So that's like head and neck, breast, you name it, lung cancers, all of that. Because I do see a lot of head and neck, and I report a lot of CBCT sort of in my daily practice. And so I just got more and more into dental pathology. And I find dental imaging to be quite a very interesting field. It's quite different to sort of the things that happens in the rest of the body.
Obviously, you've got a lot of experience, and a lot of the things that you're going to be talking about today are going to be very second nature to you. And there'll be people listening to this podcast with various levels of experience around CBCT. Some will be really familiar and comfortable with it. Some will be perhaps new to understanding about CBCT. So I thought it might be useful if we just start at the beginning. What is CBCT? So we can make sure that everyone's starting with the same understanding, the same baseline level of knowledge. Can you just give us a bit of an overview of what CBCT is, how it's used, how it's adopted in general practice?
The CBCT is really an acronym for cone beam CT. So that is cone beam computed tomography. So what it is it's actually very similar to an OPG that I'm sure a lot of listeners are familiar with. It's an X-ray machine in basic terms, and it fires the X-ray in the form of a cone, therefore cone beam. Yeah, very intuitive there. But what it does is that it acquires the image or the target structure in a 3D data set. So it's, instead of being a 2D, as we see in OPG, it is 3D. It means that we can scroll through things in various different planes, and that's very similar to what a medical CT allows you to do. And so really the two machines are actually very, very similar. Like with the OPG, you probably don't know if you remember, there's an emitter, an X-ray source, and there is a plate, and that spins around you. And that forms a panoramic or stitched view of your jaw, right? Yep. Well, CBCT is actually exactly the same setup, but instead the receptor and the processing unit is able to reconstruct all that information into a 3D data set. So that's really only a difference. It's still an image plate, an X-ray source that spins once around you, and there you go. You've got all the 3D information you have.
And so in terms of uptake, adoption, have you seen any stats or have any insights about how readily dentists are using CBCT now compared to traditional 2D imaging such as the OPG? Is it growing in use? Is it becoming more and more popular?
The last sort of major research that came out of Queensland University in 2014, and that actually looked at the number of CBCT that was registered in Australia. That was 420 at the time, but this was 8 years ago. As you can understand, the data is old, but certainly, and since then, there hasn't actually been any new data that's been released. But certainly on the ground, anecdotally, talking to a lot of my dental colleagues, there's been a lot of uptake of CBCT. Just because I think the dental practice is changing. There is a sort of a trend toward precision medicine. There is a trend toward making sure everything is well planned, everything is more precise. So then I think the adoption of CBCT has really come very quick from that. And speaking to even sort of manufacturers, they would quote increase in sale about 20% year on year. So yeah, take that as where you.
So it's obviously becoming more and more popular, more and more applications for it. So let's talk about those applications and the benefits of CBCT. So, if you're a general dental practitioner or indeed a specialist dental practitioner, what are the benefits of CBCT over traditional imaging? We've spoken about the 3D imaging, which we all understand and appreciate, but what does that mean in real life? What does that mean in terms of application? What does it mean in terms of planning? What does it mean in terms of commercial opportunity?
Yeah. So I think I'll split that out into sort of two sections. One is, as you said, the clinical diagnostic side of things, and the other side is the commercial and the business benefit. So if we were to talk about the clinical benefit and the advantages over traditional 2D is that it is giving you 3D information. And that can be quite important because with 2D imaging, sometimes the images can be distorted because of magnification and artifacts and things like that. But with 3D imaging, the measurements, the image is much more precise. So this is therefore very useful in sort of procedural planning. And for, subspecialties such as like endodontics, orthodontics, periodontics, where they need that high precision information. So for example, with implantation, you want to be assessing the distance to the adjacent structures like the inferior alveolar canal. You want to plan the height and the width of the implant site, look at the bone density, and then, in endodontics, you will need to look at the tooth anatomy. You need to see the canals, the pulp chamber size, all of that. And there are a lot of good studies that shows that CBCT improves implant success as well because of that additional information. So this is where sort of the procedural planning side has a very huge use for CBCT. And then the other stuff would be the diagnostic tools, which is looking at odontogenic and non-odontogenic sort of lesions. Being able to visualize the lesion in a 3D space just carries that much more diagnostic information. Yeah. And of course, when we're looking also other application would be like accessing sort of fractures, particularly in the dental alveolar region. Sometimes the fracture could just be in a different plane and you just don't see that in the 2D imaging. Yeah, so I think that's sort of wraps up a lot of the clinical benefit.
What we're talking about there is better clinical outcomes because we can assess pathology better, we can assess the structures and plan better, and all of that leads to improved clinical outcomes. So happier patients, better treatment, all that all that sort of stuff. Okay, so what about the business case?
So in terms of the business case, I'll just give a preface in that, myself, I do a lot more of the reporting. So a lot of what I'm about to say is sort of from my discussion with all of my dental colleagues who owns the CBCT. So what they've been absolutely raving about is that with the CBCT, it's an enabler for comprehensive patient care. So what I mean by comprehensive patient care from their point of view is that they say, one, of course, the better diagnostic is a given, right? You see the problem, you treat it. But then the other aspect of things is that having a CBCT in your clinic, it means that your clinic is sort of like the one-stop shop.
Yep.
Particularly in this sort of day and age, with COVID and all stuff like that. I think people just don't want to be traveling to places. They don't want to come to the clinic, be sent to another place for imaging, and then come back and you have to book another clinic. How about just come to the clinic, have the CBCT done same day, and then be able to have the consultation same day and have the treatment planning done all in one go. So I think that does bring about a very good sort of patient satisfaction factor. The other business aspect is there's a wow factor to viewing everything on 3D. Absolutely like it. I think it's more intuitive to look at something, to look at your jaw, look at your teeth, and the way things have. So for example, impacted teeth, and looking at the degree of resorptions. And the degree of damage to the surrounding structures, it is so much easier to look at it on the 3D film.
Yeah.
So then when you have that in front of the patient, it's just so much easier for them to say, I see the problem, and therefore I'm more than happy to accept the treatment. So in a lot of ways, CBCT is an enabler. It's sort of like what I think, it's like the workhorse behind the scene. The reality is I don't think you'll be able to bill CBCT, charge CBCT because Medicare rebate unfortunately is not there for the general dentist to be able to get your money back for the machine itself. But what it does is enables all the other things you can do with it. More treatment, better patient outcome, better patient satisfaction, and that is what will help drive the revenue.
You're absolutely right. Patients are always curious to see themselves. I'm curious to see myself when I go and see, have various imaging bits and pieces done as well. It's always nice to see that 3D image because it's a curiosity factor. It's an interest factor. There's nothing quite as captivating as ourselves sometimes. So,
That's right.
It's fun to see. I wanted to ask you a little bit about radiation dosages because one of the questions that I've heard patients ask relatively frequently is, what's the dosage, in comparison to, plain film or 2D imaging? Can you just have a bit of a conversation around that? Because I know that lots of dentists will be getting asked that question too.
Absolutely, yeah. And now you're really getting into sort of my zone of joy and pride. So really with radiation, just to put things into a bit of context, is that, yes, radiation does cause a lot of anxiety. I definitely see that not just in the general public, but also in our medical colleagues and our dentist colleagues as well. But the reality is that I think as prescribers of radiation, we do need to be cognizant that radiation can cause harm, but it's about grasping the data about exactly how much harm that is.
Yeah.
Because then that's when you can make very informed decisions about the benefit and the harm when you refer somebody for a radiation imaging procedure. So just to put that give you a bit of a reference. So this is going back to a bit of radiation 101. So the measurement of radiation harm dose is a unit called sieverts. So what that you might see that when you read the brochures about CBCT machine and the amount of radiation, you will see that. So it's called sieverts. So what sievert is, it's a unit that takes into account of the energy of the radiation, higher the bad, the type of radiation, but as well the susceptibility of the target being irradiated. So what that means is, for example, if like I have a gun and I shoot at a steel plate, the steel plate probably doesn't feel anything. But if I shoot it at like a pillow, that's probably going to blow up. Yeah. So therefore, the steel plate is actually not susceptible in this case. So it matters what the target organ we're irradiating. So that's a sievert. So at the high end, you've got sort of 1 to 5 sieverts. That's levels of atomic bomb, Chernobyl fallout incidents, right?
Oh, wow.
And so that is like I would say 50%, if you're exposing someone to 5 sieverts, 50% will unfortunately pass away in 30 days. So that's called the lethal dose. Yeah, so that's 5 sieverts, okay? 1 to 5 sieverts. Medical imaging that we use to on a day-to-day basis, like a CT head, is actually 1,000 times less than that.
Wow.
Okay? So that's about 5 millisieverts, so 1,000 times less.
Yeah.
Now, so what is that in dental imaging? So the reality is in dental imaging, the amount of radiation is actually a lot even lower than that. That's 10 to 100 times less, in fact, compared to medical CT.
Yeah, okay.
So we're talking about microsieverts here now, in the field of 100 microsieverts to sort of, down to 30 microsieverts.
Yep.
And that's CBCT.
Yep.
So once you actually grasp that, you realize it's actually very low radiation dose. And one of the biggest studies actually that looks at the harmful effect of medical CT actually came out from Australia. It came from the University of Melbourne. And it showed that they looked at like 11 million patients. That's a phenomenal study, huge. They showed that for about every 100,000 people that you irradiate, there will be 9 additional cases of cancer per year. So if you and that's for medical CT.
Yeah.
So, and that was about 5 millisievert. So now if you think about it, if you then have dental CBCT, which is 100 times less than that, then we're talking about 9 additional CT in 1 million, 9 additional cancer in 1 million people, in 10 million people every year. But that's, over the period of, 10 years, that's still, very, very small numbers.
Yeah.
So I think once you truly understand that, I don't think you need to be frightened of radiation. And what it is simply knowing that, yes, it does cause some harm, but if you truly believe that the benefit of sending your patient for a CBCT will offer better diagnostic information and better patient outcome, then that shouldn't stop you.
I remember years ago when I was doing my fellowship training, we were talking about background equivalent radiation time. Mm-hmm. Is there an equivalency for a CBCT in terms of background equivalent radiation time?
Yeah, there is. That's actually another thing that I like to use to talk to my patient about, because some of them might not conceptualize for risk in terms of probability. So you tell them about what it means in terms of background radiation. Yeah. So at the high end, it's a few weeks of background radiation. Yeah. So you can just say to the patient, just imagine, so if you lived a few weeks longer, that's the amount of extra radiation you get just by living.
Yeah.
So in a way, and after they hear that, they're actually, okay, you know what, that's actually not too bad.
Yeah, fair call. Fair call. So let's just talk about the obligations and requirements that are placed upon dentists who do own a CBCT. What sort of requirements are there in terms of particularly reporting, which I know is your area?
Yeah.
And I know that actually the whole subject of reporting does create a fair degree of anxiety around some dentists because they're worried about missing pathology. Where does their liability begin and end? So could you just speak to that for a second?
Yeah, of course. Yeah. For practice owners that own CBCT machine, they have 2 aspects of responsibility. As you mentioned, one is the reporting and interpretation, but I'll just quickly touch upon the other one, which is the actual acquisition. Mm-hmm. If you own the CBCT machine, in order to be licensed to press a button, you do need to do a course. It's very different from different state to state. So different radiation authority bodies have different rules. But in general, you have to sit a CBCT licensing exam.
Yep.
Once you pass that, you can now press the button. So so we sort out that area. So now in terms of reporting, there's actually very loose regulations regarding reporting. The only state that mandates that you have to have every CBCT reported by a medical or a dental radiologist is actually Western Australia.
Oh, wow.
Yeah, whereas with all the other states, they do not have that rule. So really the buck is in the dentist's hand as the dental sort of owner of the CBCT. When you do take an image set, the medical legal obligation states that you are responsible for all that data set. So this is where I would say, if you are taking pictures, make sure you just cone that field of view just into the area of interest. Yeah. So if you're doing endodontics sort of planning, you just need a 5x5 sort of field of view just to look at those few teeth. Don't take more images than you need, because if you do, you will inevitably see more and you will pick up more things, and that is actually your responsibility.
Yeah, wow.
But having said that, I mean, there will always be, situations where you just can't avoid that.
Yes.
Like, if you're assessing for wisdom teeth, you're taking the maxillofacial sort of range, assessing for all 4 quadrant.
Yep.
You will see a lot more. So then I would say, as a dental practitioner, you want to be just sort of vigilant. do look at the images yourself and see if there's anything that is amiss. Now, the dangerous thing about that is you don't see what you don't know. Isn't it? Yeah, it's like, or you see things and you think it's that, and therefore you don't consider the other things.
Yeah.
The more sinister things, potentially. Yeah. So my recommendation is that if you're really not sure, always refer the image on to a dental or medical radiologist, so then they can have a look and you can sort of sleep a bit better at night.
It's something that I've spoken to lots of dentists about over the years, about CBCT and reporting and so on. And I think that there is a really high degree of caution, probably knowing where their limits of diagnostic skills begin and end, and being really proactively referring that out, because no one wants to miss something. No one wants to be the guy or the girl who, misdiagnoses or indeed doesn't diagnose at all some sort of pathology, and then the patient has an adverse outcome. Irrespective of the medical legal stuff that comes after that, it's all about making sure patients get the best care. But in terms of other things to consider when they're looking at CBCT machines, we've spoken about field of view, acquisition time, and other things. What are the factors that need to be taken into account when someone is thinking about getting a CBCT? What's important, what features are important, what's not important?
So there's a lot of vendors out there, different manufacturers, and all of them obviously are going to say, their machine is the best, right? So yes, you're going to be, it's going to be like a sort of a minefield of information that they will bombard at you. So speaking to my dental colleagues whose own CBCTs and has gone through that process, I think they've actually given some real good wisdom. One, I think the most important thing is you just want to make sure that the machine will actually just fit in your real estate. Yeah. Because everybody's everybody might have different sizes of a dental room. Just make sure the machine will fit first, right? That's the first thing. Yeah. Second thing is I think is very important, and even extends to sort of all the medical equipment I have to deal with, is the after purchase service. So what that means is, yes, you're going to have a lot of people saying all about how great the machine is, but guess what? Machine can always go wrong. Yeah, there can always be problems. So how easy is it going to be for you to be able to get them back to service the machine, for them to be able to come and bring in the parts to replace anything that's damaged? Because at the end of the day, if your CBCT machine is down, the whole process come to a standstill. So you want to make sure that you have a good relationship with the vendors, and that the vendors are ones that will provide good after service care. Rest of the things is, a lot of it is just sort of the bells and whistles and all the extra customization that comes with it. I guess you want to make sure that you use the machine yourself, you tried it, and that it's easy for you to use. That's very important. Have a look at sort of type of work that you are going to do, and then what sort of extra customization you need. So for example, if you deal with a lot of young patient, you might want a machine that be able to do things, scan things much quicker to avoid that movement artifact. If you have a lot of elderlies or disabled people who can't, get up straight or stand up, you might need a machine that allows the imaging plate to come down so that they can be in more of a sort of sitting position. So just extra stuff like that.
Yeah. There's obviously some really good reasons to have access to CBCT in your practice. We've spoken about, better diagnoses, better treatment planning, better patient outcomes. We've spoken about all of those benefits. The big pitfall we've spoken about so far is the reporting and the ability to miss things if we don't have the right field of view, or we're not able to diagnose the pathology. I just want to circle back to that for a second. Are there any other pitfalls or headaches or challenges that you see coming up regularly in the work that you do? Because you report on CBCTs all the time. You've got expert knowledge in dental anatomy and the ability to report on. In fact, I know you run an imaging, a big part of reporting service, which is really useful. That's actdentalimaging.com for people who want that. What are the pitfalls that you see coming up over and over again?
The biggest pitfall that we definitely see is missing diagnosis, where there are pathology to be seen in the field of view of the CBCT, but people are simply not looking at it. Or sometimes they see it and they're misconstruing it as something else. So I'll give you actually a very good, interesting story about this. One of my dental colleague had a patient who sort of came in with several months of right cheek swelling and bleeding gums and sort of facial distortion. Went around town, seeing a lot of dentists, and they've done an OPG. And then what they say is that there was a little bit of sclerosis in the upper maxilla where the swelling is, and there was a bit of opacity in the maxillary sinus. They just thought, oh yeah, this is probably going to be just infection, condensing osteitis, and maxillary sinusitis, right? But the patient antibiotics, patient never got better. By the time came to see one of my colleagues, he did a CBCT and then sent me the imaging for review. And what was actually quite striking as soon as I have the CBCT and the 3D information is that you can actually see that this sclerotic maxillary change and the maxillary sinus change was actually one contiguous lesion. And it was really infiltrating through the facial bones, and it's even extending out into the soft tissue, which is just something that you don't really appreciate on 2D imaging. In my head, my alarm bells start ringing for lymphoma, because lymphoma is a transspatial malignancy that doesn't necessarily destroy bones, but it just go through things, right? And guess what? Like, we sent this guy immediately for ENT review, and biopsy came back. It was sinonasal non-Hodgkin's lymphoma.
Oh gosh.
Yeah, I know. So I've actually remembered that case quite well. Look, you're not going to get cases like that coming through every day, of course, right? But it's like, if you're not seeing cases like that, you will never think about it.
No.
And then, right? And then if you are not thinking about it, then you could just, maybe cast the problem off as something else, which is what happened to this patient. Just thought it was infection and just being constantly put on antibiotics and had imaging done, but really didn't really show the problem in the end.
Wow. And I've just got to ask, how was the patient? Are they okay in the end?
Yeah. So lucky that the lymphoma was very much localized.
Yeah.
So the ENT people were able to get in there, sort of debride most of it out and start chemotherapy, and that that was very helpful. Yeah.
Right.
Patients, I think, as far as I know now, the patient's doing well.
Yeah. Well, thank goodness that's got a happy ending, because it doesn't always have happy endings sometimes. But
no, exactly. Yeah.
So that's good. Acrane, are there any other pitfalls or challenges that you think dentists just need to be mindful of as they go through their own CBCT journey?
I think CBCT is going to be increasingly adopted into the dental clinic. I see that as being a trend, just with how it is in the medical field as well. As I said, like, these days, I think there is just less forgiveness almost, and less room for people to miss things, right? And as a result, we are using better and better diagnostic tools in order to make sure every patient gets the best outcome. To understand that, yes, there will be, CBCT will certainly have a lot of benefits in terms of your practice, but do be cognizant of one, radiation. So you still want to make sure you're reducing radiation dose for your patient. Yep. So control the field of view, making sure that if the patient doesn't need a CBCT, if you don't need a 3D image to change that management, don't do it, right? And the other thing is, and if you do it, do make sure that all of the data image set is interpreted. Yeah. Because the last thing you want is really to not be able to sleep at night because you missed a big pathology, and that a bad outcome happens for the patient. Acrane,
you do run a reporting service which is called ACT Dental Imaging. If people want to find out more about how to utilize a reporting service, how do they get in touch with you? Is it through the website? What's the best way for people to kind of go, I want to integrate CBC to my practice. I want to do it well. I want to make sure we're reporting well, doing all the best practice things. Yeah. How do they best contact you to find out more about getting reporting done?
Yeah, just visit our website. We have all of our contact details there. There's a phone number as well as an email. So just flick us an email, flick us a phone call, and then we'll be out at the end to answer any of your queries.
Okay, and so the web address is actdentalimaging.com, ladies and gents. Yeah. So head across to that. If that's going to be useful for you, I'd really encourage you, if you're going to use CBCT, obviously we all want to do the best thing for our patients. We want to make sure that everyone's getting the best care. And as Acrane said, you want to be able to sleep at night as well. So Acrane, this has been a really interesting conversation for me, because this podcast is typically not so clinically directed as more around commercial and business. But I think this is a really good blend because, good business does require good patient care. And good patient care means adopting best practice. And if we can plan better treatment, if we can diagnose more effectively, if we can improve our patient outcomes, that's really good for business. And it's good for the patients. It's good for professional satisfaction. It's good for all manner of things. And what I really have appreciated about what you've said is it's a really, you've obviously got a high level of academic knowledge, but this is a really practical conversation about how to do it and how to do it well. So as someone who appreciates that practicality, I just want to acknowledge that and say thank you for taking the time to come and share that with us today and making it really accessible for the broader audience. You're a good man, and I'm grateful that you've come along today. No,
thank you for having me. It's really good to be able to sort of pass on some of these pros to our listeners. And I really appreciate that.
Thank you for listening to the Savvy Dentist podcast. For more episodes, go to drjessiegreen.com/savvydentist. And to discover how to build a high-performance dental practice, visit drjessiegreen.com and download the free report.